Hi there, I hope you're having a very good day today. My name's Matt and I'm one of the chiropractors working at Truro and St Austell Chiropractic Clinic down here in Cornwall. Today we're going to have a brief conversation about neck pain and stiffness. We're going to be talking about where these symptoms may come from, what they mean for you specifically, and more importantly, what you yourselves can do about it to get alleviation from these symptoms in the long term. So without further ado, I think we can get to it. So the first thing that I'd like to address, and possibly the main question that you have on your minds right now, is actually why do these symptoms develop in particular parts of the body? Well, a lot of research has been done on pain and how it develops. And what we're finding now is pain does not equal tissue damage in many cases. Rather, pain is a complex experience that's processed in the brain, and lots of different factors can play into these symptoms that we develop. Factors such as chronic sleep deprivation, chronic inactivity, poor diet, emotional health issues, or even things such as changing your job if one job has a very different demand and need than the other. You know, these quite major lifestyle and habitual changes. Okay, so now that we've clarified those ideas, we can move on to what we can actually do about it. So, bodily movement should be considered a skill. And as with any other kind of skill out there, if you don't utilize it on the regular, you are going to get a bit worse at it as time goes on. Perfectly normal, happens to the best of us. But the good thing about considering bodily movement as a skill is that, as with any other kind of skill, it can be improved upon with regular practice and exercise. This process can then be sped up with regular supervision and checkups with a relevant manual therapist, be they a physiotherapist, osteopath, or chiropractor. The way that I'm going to be showing you guys how to deal with your symptoms at home today is going to be through some strengthening and movement exercises for the various different ranges of motion of the neck. We're going to get the neck and the muscles better at interpreting pain and movement and get a healthier and hopefully further range of motion in the neck as well. The exercises that we're going to be doing today are going to be very base level. There's not going to be any equipment involved, and with each exercise that I'm going to show you guys today, we're going to show some variations as well, just in case you have any other considerations, or if for whatever reason you can't do that particular form of exercise. So it should be available for the vast majority of people to do. Now, it must be mentioned that, as with any musculoskeletal or body issue, every person's body, symptoms and backgrounds and situations are going to be different. As a result, the improvements and the effects that you get from these exercises are going to vary from person to person. Some people have had massive successes in the increase in range of motion, for example, whereas other people, for example, elderly patients who have pre-existing bony changes going on in the spine, in the neck, may find that their range of motion may not increase very much. Your improvements will vary depending on what's going on in the background. However, even if we're not looking at achieving these maximum improvements can still be made. The range of motion that you will have will be healthier, and not only that, but you'll be much better at preventing further developing pain or symptoms in these regions if you keep these exercises going on the regular. This is for long-term improvement of your symptoms. And of course, it goes without saying that if for whatever reason you have any accompanying health conditions or have any other reasons why you may not be able to do certain exercises or any conditions in and around these areas that you do know of, I would recommend consulting your relevant health practitioner just for a little bit of advice as to what you can and can't do. These exercises are very, very base level, very low grade. There's no impact or real weight involved, but just to be on the safe side, if you have any massive reservations about anything, consult a health professional before carrying on with these. So the first exercise we're going to do today is as basic as they come. It's a basic range of motion practice and exercise for the joints and the tissues of the neck. You can do this sitting or standing, whichever you prefer. So have yourself in a nice neutral position facing directly forward, and what we're going to do is that we're going to practice taking the neck first of all into rotation as far as you can go both ways, and then we're going to do side flexion both ways and forward flexion and extension both ways. Now, as you may have noticed, my range is really quite far because this is something that I've been practicing on the regular myself. Yours may not be as far for now, and that's absolutely fine. Just as you're doing the motions, appreciate the movement that you do have, avoid any sharp pains, and don't hold the position for too long. Just almost appreciate the elasticity of the end feel. Just take it all the way to the end, feel the end, and then just come all the way back. Okay, so next one we're going to do is a basic progression of that. We're going to be adding some resistance to the movement so that there's muscle contraction, but there's no actual shortening of the muscle and there's no movement of the neck. So just again, neutral position, facing forward, and what we're going to be doing is engaging the muscles to do the same motions, but we're going to be using our hand to stop ourselves, and we'll be pushing against our own hand. So if we start with right rotation, I'm going to have my hand up here on my temple. I'm just going to try and engage right rotation, and I'm pushing against my hand here and maintaining that contraction for 3 to 5 seconds and release. And again, 3 to 5 seconds and release. A lot of patients out there, if you have shoulder issues, you may not be able to get your arm all the way up here, or if you're having a headache, the temple might be a little bit sore. So feel free to place your hand wherever is most comfortable. And if for whatever reason you actually can't do that right rotation with the resistance, that's fine. Practice the other ranges instead. So similar, we can do to left rotation, engaging the muscle, and we can do forward flexion, maintain for 3 to 5 seconds. Extension, that can be done against a chair or wall, for example. And then we can do left side flexion and right side flexion. Right, so that is the warm-up for the exercises that we're going to move on to. Now we're going to start engaging the trapezius muscles around the neck here and start getting them conditioned and more used to movement as well. So, again, can be sitting or standing. Just make sure that you have, if you are sitting down, enough room beneath you, preferably not on a sofa, not on an armchair, a chair without any sides, so you can actually let your arms dangle down beside you, because we want to start off with as relaxed shoulders as they can be. Just let them relax here, neutral head position here, and what we're going to be doing is we're going to be engaging the shoulder muscles and bringing the shoulders as high into the ears as possible. If you feel a little bit like a tortoise, you're doing it right. And we're going to hold for 3 to 5 seconds and a nice slow descent back down. We don't want any sudden dropping of the shoulders. With muscle health, the lengthening and the dropping of the muscle is just as important as the shortening and the contraction of the muscle. So if we go through that again, just let the shoulders relax first of all, take them all the way up to the ears, hold for 3 to 5 seconds, and back down. The good thing about this exercise is that it can actually be practiced in other positions than this as well. So I'm going to come a little bit closer to the camera to show that off. So what we were doing was shoulders in a neutral position, taking it up into there. If you want to work some more of the forward fibers, if you feel that that's where your pain is worse, or if you just don't agree with the shoulder in the middle position, you can bring the shoulder forward, tuck into the front body, and do a very similar shoulder raise, hold for 3 to 5 seconds like that. It should feel very different, and you may prefer the difference in position. And as well as forward, we can go backwards if you feel that your pain and your aches are more situated around the shoulder blade here. So we can take the shoulder back and then do a nice little shoulder shrug up towards the ear, 3 to 5 seconds, and drop back down. Now that one, because there's a lot more muscle bulk at the back here, may have more of a pinching sensation. So just be aware of that if you're going to do that, if you prefer it. Okay, so to further develop that movement, we're going to be adding some overhead shoulder movement now. This may be a little bit difficult for patients who have pre-existing arthritic shoulders, or who are developing or are recovering from a frozen shoulder or an impingement syndrome of the shoulder, but we'll have a conversation about that after we do the exercise itself. So what we're going to start off with is a good 1.5 feet between us and our feet and the wall, to allow us to have nice extended arms with a slight lean into the wall. We don't want to be too close because we want to have nice straight arms with a slight lean. As well, we want to keep the body nice and straight. We don't want any collapsing in the midriff. We don't want to overcompensate. Just keep a nice straight awareness of the body here. We're going to have it like so, slight lean in, and what we're going to do is that we're just going to engage the shoulder muscles, and as a result, slide the hands up the wall as far as you can go. Let yourself fall into it. Appreciate the stretch at the front of the body for 1 to 2 seconds, and then we're going to bring it back down here. So I'll repeat that in a fluid movement so you get more of an appreciation. Start here, take the shoulders up, appreciate the stretch, and then come back down. You may feel your heels lift up off the floor a little bit as you get up to the top. If you feel that you lack stability as you're getting further to the top, as your heels are coming off the floor, just don't go as high as I do. With all of these, especially for patients with arthritic shoulders or recovering or pre-existing frozen shoulder, take it to the range that you can do. Just make sure that you appreciate and feel the movement all the way through, and again, avoid any sharp pains that may emanate as we're doing those overhead movements. And if you need to, start a little bit lower with a little bit more of a lean into the wall if you just want to take it up to about there or so. Just adapt it to how you need it to be for yourself. Okay, so now moving on to the most difficult, the most intense part of the exercises, probably the most difficult for the vast majority of patients out there. We're going to be doing some press-ups. Now, a lot of patients don't like the idea of doing press-ups because they may find them quite difficult. However, I will be giving lots of different variations of press-ups to hopefully find a variation that's appropriate for your level. So just going to start off with showing you how to do a proper press-up. So we're going to be doing this on the floor, carpet, wood, whatever's absolutely fine. If you've got any sore knees, either through bruising or arthritis, then put a cushion underneath you. And we're just going to be placing our hands just about shoulder width apart. If for whatever reason your wrists can't take a lot of extension, make a fist. Now this does place quite a lot more strain on your knuckles, so just be aware of that and appreciate how that feels before you do it. So I would recommend doing it in an extended wrist position if you can. And then we've got a nice plank here. Keep it nice and straight, no bum tucked out, not too arched back. Have it just like so, elbows parallel, and focus on control on the way up and the way down. We're not really looking for speed with this, we're just looking for control. Now, next variation we're going to go on, that will make it hopefully easier, if that one's a little bit too difficult, is to do it on our knees. Keep the cushion underneath there if you need it, feet behind, can be doing whatever. So, similar hand position, and again, nice and controlled on the way down and back up. As well, with this exercise, you don't have to go all the way down to the floor if that's a little bit too difficult. You can, if you want to, just go halfway, or you can go even less, just about here. If you wish, just find the variant that's most appropriate to your skill level. So here we are back at our trusty wall. This wall press up is as easy as a press up can get, and the good thing about wall press ups is that there are lots of variations to it depending on your level and what your body prefers. So we're going to start off ideally with a position that is exactly the same as the arm wall slides that we did prior. So arms nice and straight, slightly in into the wall, nice straight plank here. And we're just going to let ourselves come into the wall, elbows kept parallel, and back up. Elbows kept parallel, and back up. Now, the reason why this has so many variations is that you can really play about with the position of your hands on the wall, what your arms are doing, and how close you are to the wall. So for example, if getting your shoulder to 90 degrees is difficult because of some shoulder issues, you can take your hands just a little bit lower, and you can just go instead to these kinds of movements here. Or if you want to have a bit more of a anterior fibre stretch here and work more of the back portion of the fibres, you can instead bring the arms a little bit higher and just let yourself come in and back out. There's a lot of room to play about with this one, and that's the last one that I'm going to show you guys for today. Right, so that was all the exercises that I was going to show you guys for today. So now that you've got those under your belt, the question then needs to be asked, okay, how often do I actually need to do these? Well, first of all, it depends what your goals are. It depends how quickly you want to progress with your improvements. Also depends on the severity of your symptoms. Now, I've given you quite a few exercises today. If you can perform them all during each session, that's absolutely brilliant. The body likes variation. But if you find that you don't like a certain type of exercise, or that you're quite hard pressed for time in your day-to-day life, then don't be afraid to cut down the number that you do. As long as you keep 3 or 4 of those exercises per session, that should be absolutely fine. Now, how many sessions should you aim to do then? So to start off with, I would recommend doing at least 2 a day. Once in the morning, once in the evening works really well for quite a few people. And in each session, perform each exercise that you've chosen per session. And with each exercise, I would like you to do what we call 3 sets of 10. So each exercise, do it 10 times, and then a short 30-second rest, another 10 times, short 30-second rest, and then another 10 times for a total of 30, and then after that you can move on to the next exercise. Now, don't be afraid to mix this up a little bit. If you feel that you can do more and you want to do more, that's brilliant. If you feel that you can't do all 30 for whatever reason, that's absolutely fine too. And don't be afraid to mix and match which exercise you do at which set, at whatever time. Play around with it, see what you get out of it, see what you prefer. So that will be the end of that for today. You've now been armed with all the knowledge that you guys need to take your symptoms into your own hands and to get alleviation from these symptoms in the long term. So let's recap the main points that we went through today. First thing, pain does not equal damage, and your symptoms of pain and stiffness in that particular area of the body are very unlikely to be any underlying physiological or anatomical issue. If you carry on with these exercises on the regular, you're practicing your bodily skills and your body will thank you for it in the long run. So I hope you enjoy it the rest of your day and best of luck.